Morning, everybody. Today's class is about perimetry, which is the method of accurate charting of peripheral field of vision by using an instrument called perimeter. A perimeter is an instrument used to determine field of vision. Clinically, the field of vision is determined by confrontation method. So, in today's class, we'll know some idea about what is perimetry, what is the visual fields, how do we define field of vision, how do we plot the visual field and factors affecting. Finally, we need to understand that how the visual field defects are depicted. So, it's a method of accurate charting of visual field using perimeter. We use confrontation test. It's a bedside method. It's 1 meter we sit across and close the opposite eye of one another. That means if we're examining the right eye, the left eye should be, and we tend to see the different fields, the temporal, superior, inferior, and nasal. So the physiological importance is to detect the exact nature and extent, the defect of the field of vision. So what is field of vision? So the aim of the experiment is to map out field of vision of the given subject. So what is the aim? To map out. So it can be a central field or a peripheral field. But in perimetry we are depicting the peripheral field. The central field is by Gerard screen. What is the method? The mapping of central field is with the help of a tangent screen called as Gerard screen, in which a white target is moved across a black screen. So this is the introduction. And we need to understand how the fibers cross over, the optic chiasma, and finally we have the optic tract with Mayer's loop and von Willebrand's knee, and the geniculocalcaline projecting onto the. So we need to understand that there are some fibers which do go to the superior calculi, and from there they project to the pretecal area that mediate visual reflexes. The fibers originating from the lateral geniculate body form a loop at their origin called as Mayer's loop. Here you can see the different fields, defect and visual field of an optic nerve. So this you'll come to know in detail how different fields are lost once we start doing the experiment. You can see the macular sparing, hemianopia, homonymous, heteronymous. Okay. So there is some amount of macular sparing and if macular. So the retina projects to 4 subcortical regions in the brain. The lateral geniculate nucleus, it is the major subcortical center relaying visual information to the primary visual cortex. The superior colliculus, which controls orienting eye movements, that is the visual reflexes. The hypothalamus, which regulates the circadian rhythm, and the pretectum, which controls the pupillary light reflexes. So how do we define? It is part of the space around us which is visible through non-moving eyes. Or the clear-cut definition is the portion of the external world visible to the eye when the gaze is fixed at a particular point is called as field of vision. So what is field of vision? The portion of the external world visible to the eye when the gaze is fixed to a particular point. It depends mainly on the size and color of the object used for mapping the field. So it's limited by the size of the retina, the orbital margins, the nose and the cheek. Larger to light and bright objects. Unpaired temporal crescent in the peripheral moving stimuli which cause specialized movements sensitive to receptor cell. Responsive to sudden appearance and disappearance of stationary visual stimuli. So in the temporal field, of fixation point at about 12 to 15 degrees, a scotoma blind spot is located where perception of light does not occur. Why? Due to the absence of rods and cones. There are no receptors. This is called physiological scotoma, and it corresponds to the optic disc in the retina which does not contain rods. It measures approximately 7.5 degree in height and 5.5 degree in width. The visual field of both eyes overlap in their medial part to form the area of binocular vision, in which objects are seen by both the eyes. The extent of visual field is described under this. So that was about the peripheral field. We have the central field, which is the macular field, which can be assessed by color vision. The form detail can be perceived. It is tested by the assessment of the visual acuity. Visual field depends on the size and color of the object. Standard size around 5 mm, and the color should be ideally white, and it keeps decreasing. If it is red, then if it is visual acuity is better for a white object than colored objects. Thus, the field of vision is better delineated with a white object. Roughly, the field of vision obtained by using blue and yellow objects is less by 10 degrees, and that by using red and green objects is less by 20 degrees from the visual field obtained by the white object. The standard size is around 5 mm. So, what is physiological blind spot? I just explained to you. It is on the temporal side of the fixation point at about 12 to 15 degree. A blind spot called as scotoma is located where perception of light does not occur. This is called physiological scotoma, and it corresponds to the optic disc in the retinal width, which does not contain rods and cones. So this is the different field, the left visual hemifield and the right. For binocular zone there is overlap. So the fixation point, the fovea, and the temporal hemiretina and the nasal hemiretina. This is how the visual field and the field of vision is assessed. So how do we plot a bedside method called as confrontation testing? Here this method is called as finger confrontation test. We need to sit exactly 1 meter opposite the subject. Patient's right eye and the examiner's left eye. Hold index finger at eye level midway between the two, that is subject and examiner. Move finger in all 4 quadrants from lateral to medial. There is also called as red pin confrontation, which is sensitive for red central field. Central scotoma can be recognized. One eye is covered while the other is fixed on a central point. That is, the gaze is fixed on the central point. A small target is moved towards the central point along the selected meridians. Along each meridian, the location where objects become visible is plotted in degree, and it is repeated in different meridians. So we have a large and a small oval represents the approximate size of normal blind spots. You can see that the round ones are, and the radius are the meridians. The round circles of every 10 degrees is your isopters. So we need to understand that the part of the external world visible to a person when he fixes his gaze on object is called field of vision. The method of charting the field of vision is called perimetry. The field of vision charted with one eye and the other eye closed gives the field of vision for that eye. One eye is covered while the other is fixed on the central point. A small target is moved towards the central point along the selected meridians. Along each meridian, the location where the object becomes visible is plotted in degrees and repeated in all meridians. Determination of visual field by confrontation is for the second cranial nerve. There are different types of perimeters like squares, hand perimeter, half sphere perimeter, Maggiore self-recording perimeter, Walker's perimeter, Humphrey's perimeter, octopus. But the standard is the Lister's perimeter, which we use. So this is an instrument that accurately maps the field of vision. There are different types of perimeter available. The commonly used perimeters are Priestley and Lister's. The Lister's consists of a broad concave metal arc, which can be rotated around its center, clockwise and anti-clockwise. The metallic arc is graduated in degrees. There is a groove in one limb of the metallic arc into which the test object is fitted. The concavity of the arc faces the subject. The arc rotates through various angles on pivot in any direction along with the test subject. There are two metallic chin rests at the back of the perimeter. There is arrangement for fixing the perimeter. So we need to know it as a metallic arc. The test object is usually white, two metallic chin rests, and the chart which fixes on the back of the chin rest is with two cups. The arc is marked from 10 to 190 degree, giving the depth dimension to the visual field. The meridians are 15 degrees. Increments are marked by radial lines starting from the center, separately from right and left of the circle, starting at 12 degree position, which is taken as angle 0. The normal average right and left visual fields are printed on the reference, and the blind spot is also printed. So the perimeter chart, the center of the chart corresponds to the visual axis. This concentric circle around the center denotes the point of equal visual acuity called isopters and are marked in degrees at 10 degree intervals from the central fixation point. The perimeter chart contains lines through the center of the circle denoting various meridians. These radii of the meridians are marked at 15 degrees intervals. A black oval dot on the horizontal meridian at 15 degree either side of the central fixation point corresponds to the normal blind spot. For comparison with the normal field of vision, right and left visual fields are marked on the chart as dotted lines. For mapping the visual field, the chart is fixed to the back of the perimeter. So test objects can be of 5, 10, 20 mm size. It's placed in the groove. The test object moves with the knob which causes the movement of pin. The procedure is, the precautions were proper instruction to the subject. That means the procedure was read the perimeter chart, give proper instruction to the subject, ask the subject to sit on a stool comfortably in front of the perimeter, arrange the perimeter in such a way that the concavity of the arc faces the subject, ask the subject to sit straight and rest his chin on one of the chin rests. When the field of vision of the right eye is to be tested, the subject should rest his chin on the left chin rest. This brings his right eye in line with the fixation point. Focus the eye to be examined on the fixed object, which is white object of 5 mm size placed at the center of the metallic arc. It should be emphasized that the subject's gaze should be fixed at the object throughout the maneuver. Fix the metallic arc in one meridian. Move the test object, which is fixed to the carrier, along the arc gradually from the periphery, that is 90 degree, towards the central fixation point. Ask the subject to indicate when he sees first object and note the point. Note this reading in degrees on the arc by marking on the chart for that meridian. Repeat the procedure at 15-degree interval till the field of vision is plotted in all meridians of the four quadrants. The blind spot is marked along the horizontal meridian in the temporal quadrant by marking the point of disappearance by bringing the test object towards the center after initial appearance in the field and point of reappearance with further movement of the object in cell. This gives an idea of the size of the blind spot. Repeat the whole procedure in the opposite eye on the same chart. Observe the obtained field of vision and compare it to the normal visual field depicted in the chart. Note the size and sight of blind spot. The precautions are the subject, proper instruction to the subject. Before mapping the field of vision, the perimeter chart should be studied thoroughly. While testing for one eye, the other eye should be closed. The eye should be fixed on the central fixation point. The procedure should be repeated at every 15-degree intervals till the field of vision is plotted in all meridians. The mapping should be done in a clockwise direction. The blind spot should be marked along with the horizontal meridian in the temporal quadrant. The field of vision should be tested for both the eyes separately. Illumination should be adequate throughout the procedure. The subject should remove his glass if he normally uses them, otherwise the field of vision will be restricted. So the color of the object, we have white object better, yellow and blue, the field of vision decreases by 10 degrees. For red and green, another 10-20 degrees. Larger the object, better the field of vision. Standard size used in perimeter is 5 mm, which is white. Brightness, contrast, illumination affect visual acuity and test therefore the field of vision. Poor illumination decreases the visual field. The normal field of vision with a white object of 5 mm size is temporal, it is around 100 degree. Since there is no anatomical obstruction on the temporal side of the eyes, the extent of field of vision in this quadrant is more. So temporal we have 100 degrees. Inferior 75 degrees. Maxilla of the cheek provides anatomical obstruction and reduces the extent of field in this quadrant. Superior at 60 degrees. Supraorbital margin provides anatomical obstruction and reduces the extent of field in this quadrant. Nasal at 60 degrees. Nasal bridge provides anatomical obstruction and reduces the extent of field of vision. So you know that if there is a defect in the same side of both the visual field, it's called as homonymous defect, and a defect in half of the visual field is called hemianopia. A defect in the opposite side of the visual field is called heteronymous. Complete blindness occurs if there is a lesion in the optic nerve. Homonymous hemianopia is if the lesion of optic tract causes this defect. Right side of the optic tract produces right homonymous anopia, and lesion in the left optic tract produces left homonymous hemianopia. Heteronymous hemianopia is a lesion that affects the optic chiasma. Bitemporal hemianopia is seen, whereas binasal occurs rarely. Homonymous hemianopia with macular squaring is due to a lesion in the geniculocalcarine tract which causes this defect. Macular sparing is loss of peripheral vision with intact macular vision, which occurs because the macular representation is separate for that visual field, peripheral field, and is large related to the peripheral fields. Therefore, the lesion in the occipital cortex must extend to the larger areas to affect peripheral as well as macular field. So, in today's class, we came to know the different field of vision in temporal, inferior, superior, and nasal. The instrument used is perimetry. The standard size is 5 mm. Ideally, the white object. It has a metallic arc and a charter and a chin rest. And the gaze is fixed and the movement is from the periphery to the center. As soon as a diabetic patient comes, we usually do fields. It is called as fields. So you come to know different fields of vision. If it is due to complete blindness, heteronymous, homonymous, or Homonym is unambiguous with macular sparing. So with this, we have finished perimetry. Any questions you can ask.